So what is a tummy tuck and why would a woman want a tummy tuck? Everyone, so if you're listening to this video, you're probably considering a tummy tuck and you're wondering, how do I get the best procedure? How do I have the least amount of complications? And this is something that I want to share with everyone watching this channel so that they can feel comfortable going to surgery. This is Dr. Shim Ching. I'm a board-certified plastic surgeon in Honolulu, Hawaii. So I've been doing this for 20 years. I practice not only in Honolulu, but I also practice in the Middle East, in Doha and Dubai. I've trained all over the world, in North America, in Europe, in Asia, in South America. So I feel like I'm uniquely qualified to talk about this subject. Tummy tucks, breast augmentation, liposuction, those are the three bread and butter procedures that most plastic surgeons will perform very regularly and very comfortable with after they have as much experience as I have. And my goal from this video is to tell you what you should consider before your procedure so you get the absolute best procedure from the best surgeon so that you feel completely comfortable going to surgery. You know your complications so that you can address these in your consultation. You know, ask your surgeon what they can do to prevent these problems, because these are problems that I see when patients come to me for revision surgery, and this is what I want you to prevent. I want you to prevent a complication that requires a revision so that you get the absolute best experience and the best result possible from your procedure, wherever you are, whoever you choose. So what is a tummy tuck and why would a woman want a tummy tuck? Well, this is a very common procedure just because so many women have children. And it's not just women who have children that have this procedure. Patients who have extra skin, who have extra fat, who have experienced a lot of weight gain and weight loss, even patients who haven't had any children or significant weight loss could benefit from this procedure. And even men on occasion will get this procedure as well. This is a procedure to reshape the abdomen so that it is flatter, it looks nicer, it looks more like how a patient was when they were younger or before they had children. And because so many women go through childbirth, this is a very common procedure to address the changes that occur afterwards. So after things get stretched out, after weight gain or childbirth, the skin just simply doesn't shrink back to how it used to be. Now, in some individuals it can, and those people are very lucky. So after they have children, really nothing really changes about their body. But for the vast majority of people that I see, there's a lot of change. There's a lot of loose skin that occurs after carrying a child. After carrying multiple children, the problem could be even worse. And situations like twin birth or triplet birth or multiple children can definitely accentuate the changes that occur. Not only is there loose skin, there's also the accumulation of fat. The belly button can get stretched out and distorted, and muscle separation, what we call diastasis, and that separation of the muscle layer of the abdomen can be significant and cause a lot of fullness and roundness of the abdomen that women simply don't like. Now, it's important to point out that liposuction alone can often not address all these changes. Liposuction just addresses extra fat. We'll talk about liposuction in another video. And it's a very common question to ask. Is liposuction enough or do I need a tummy tuck? And for the vast majority of patients who've had a child, a tummy tuck is going to be a better cosmetic result, but it does involve more surgery. So what do we do in a tummy tuck? We cut out skin, we rebuild or make a new belly button, we tighten the abdominal wall, the muscle layer, and we do some liposuction in general, although some surgeons won't do liposuction. All that really reshapes the abdominal area so that things look flatter, they look better, they look more youthful, and the patient feels more comfortable with the appearance of their abdomen. Now, I've made it sound very simple, but it's very nuanced, and there's a lot of things that you have to consider to give the patient the best result, the most natural result with the minimum amount of scarring so that they look the best, so they feel actually comfortable at showing that area of their body, which is the whole point of this surgery. And the problems that I see that I like to tell you all about so you can avoid them are things that make a tummy look unnatural after the surgery and a patient is uncomfortable with their result. And that's really the last thing you want from any type of plastic surgery. You want to be completely free and feeling good about yourself and for the result to look natural and for people not to look at that area and feel like it's been operated on. So the problems you want to avoid and you want to get a sense of how your surgeon does things to avoid these problems are: number one, the location of the scar. Probably the most common problem that I see that I revise for my patients if they come to me after they've had a tummy tuck somewhere else is a scar that's simply too high or hasn't been designed correctly. A perfect tummy tuck scar should be as low as possible so that it could be hidden in a bikini. That's really the goal for most of my patients in Hawaii and elsewhere in the Middle East, where they want to be able to hide the scar under underwear or bikini if they want to show their abdominal area, which is the whole point of surgery. A scar that's placed too high, on the other hand, you can't hide. And if a scar has been placed too high and too much skin has been removed, that really can't be undone. So it's critical that a surgeon plans out that incision so it can be hidden as much as possible. Every patient is different. It does depend a little bit on where the belly button is to begin with and how much loose skin there is and the structure of the body. I always want to place the incision as low as possible. The incision needs to be gently curved from side to side so that, again, it can be hidden under a bikini or underwear. A straight incision all the way across is not going to work and can be very visible with certain types of clothing or swimwear. Again, with any type of plastic surgery, when you're suturing the incision, you want to do the very best job possible. And that's the other thing that I see, scars that just haven't been repaired properly or sutured together properly. So the scar is very visible and not the ideal scar possible. In the ideal situation, tummy tuck scar is ideally placed, slightly curved from side to side, as low as possible, a nice fine line that really isn't all that noticeable when it's healed. Second problem I see is a bad belly button. And that's something that is very difficult to correct when that's been done. What I mean by that is your old belly button is cut out from the skin of the abdomen, and your belly button has its own blood supply. And this blood supply actually nourished you when you were a baby inside your mother's womb. The remnant of this does give a little bit of blood supply to your belly button, so we can actually cut it out, leave it attached to you, pull the skin down, and rebuild your belly button. I found that the results really weren't that good because it looks like your belly button has a ring of scar around it and it's been stuck back onto your body. It just never really looks natural. In some patients, I do rebuild the belly button, and there are very special circumstances when I do that. But for the most part these days, I'm actually making a brand new one. And that looks much more natural. I can place it wherever I want to in the body instead of being constrained of where the old belly button was, which has been stretched out and maybe could be in the wrong position. Third problem I see is inadequate muscle repair after tummy tuck. I've talked a little bit about how the muscles separate after childbirth. And what happens is that as the baby develops inside the abdomen, it stretches out that muscle layer that contains the ab muscles. Things get bigger inside the abdomen, things stretch out more and more. And just like the skin, how it doesn't snap back after pregnancy, that muscle layer doesn't as well. And this is crucial to give patients the best result, because once that layer separates, your abdomen becomes rounded. Tensing your core does help a little bit, but that fullness and the roundness that makes the patient still look pregnant after they've given birth to a child really bothers women. And that's something that we really have to fix with what we call abdominal wall plication. Plication in surgery means you kind of join things together, you tighten them. You put in sutures to tighten that layer that is too loose or you need to fix for some other reason. And this is what I do with the abdominal wall. You actually build a double internal corset using sutures inside the body to tighten that layer, and you sort to how it was before. That's a critical part of the procedure. Fourth thing, lack of liposuction with a tummy tuck. Now, a lot of surgeons will not do any liposuction with the tummy tuck, and I would disagree that they're not giving patients the best result. So please ask your surgeon if that's performed. You can't make an abdomen flat and have all these pockets of fat lying around it because that just is not going to look right. So the typical areas that I do liposuction in are the upper abdomen, just along the incision line, the mons pubis area, which is very important. You don't want fullness in the pubic area because that never looks nice in a woman, or a man for that matter. And then a bit in the flank area, especially at the ends of the incision, because that can form what we call a dog ear, which is an excess area of skin or fat that looks like a little bulge at the end of the incision that you don't want. Some surgeons have delayed the performance of liposuction, a second procedure, a couple of months after. I think that's unnecessary and just puts the patient through another procedure. So if you've had a tummy tuck, you've had any of these problems, please give us a comment down below. If you like this content I post every week, please subscribe to our channel. I'm gonna make a video about breast augmentation, tummy tuck, and liposuction. And this is the tummy tuck one that you just listened to. Please listen to the other ones because those are the 3 most common procedures like everybody who's considering plastic surgery to know about so that they can be best informed when they go in for the consultation so they can have the best surgery possible. Thanks for listening. Talk to you next time.